All right, we want to welcome you all in. It is April 2nd, 2021. We want to get you an update on coronavirus in Arizona and specifically the numbers. We always take a closer look at the numbers here for you so that you can make the best decisions for yourself and your family. A lot of decisions happening right now as we approach this Easter weekend. Garrett, a lot of people put their plans on hold last year and got their shots within the last month or two and are hoping for a really beautiful reunion this weekend. So we're hoping that a lot of people are able to do that and able to do that safely. The CDC out with some new rules on that, and we'll get to that a little bit later. But for now, though, we are, Garrett, seeing an uptick in some of these cases here in Arizona, albeit slight.
Yeah, you know what? Because we only do this weekly now, I'm just going to take you right to my the screen that I share with the newsroom.
Mm-hmm.
I think that's probably the best way because I have a lot more weekly data on this. So let's just go through what we have. So today we did have about 940 cases a day. This does represent an increase. So we are seeing an increase in numbers right now. There is really no way around it. We are at about 30% more cases being reported in a 7-day average than we were last week. And we've been in the positive since about March 29th. So as you can, so for the last, for the last 4 or 5 days now, things have been trending upwards. Now, does this mean that we are, is it going up quickly? No, you can still see we are about 93% lower than we were at our peak. So we are still pretty much at the bottom of the rung here. The good thing is the deaths, people who are dying, we're still seeing a dropping decreases in that number. Right now, we're at a 7-day death average of about 13, which is very low. It's about where we were in October. So let me just kind of show you what we're looking at here. This is the reported numbers that we get from the AZDHS. If you concentrate right here, you can see a slight uptick in the number of cases. A slight decrease in the number of tests, a very sharp decrease in the number of deaths, and then a leveling off of the percent positive. Just focus on this green line here. And it is pretty much leveled off at about 5%. So about 5% of our tests are coming in positive right now. And you can see here, this is the daily average case change. We are in an increase, and we're at a fairly large increase. We haven't been here since about January. That's when we had this increase, which represents the surge, but we're starting from a much lower level right now. That's why we're still at very low numbers, even though we have a very high percentage increase. Now, the problem is, of course, as you know, if we have a 30 to 40% increase next week, you and I are going to be having a very different conversation, Katie, because at that point, now we're starting to look at numbers over triple digits again. We're going to start looking at numbers in the thousands. Hopefully that does not happen. Here's the vaccine rates. You can see that our vaccine rates are fairly level at about 60,000 on a given day. There are some lower days here and there, but pretty much 60,000 is where we we add to on a daily basis. And then let's see, what else can I add here? I think that's pretty much it. Here's what I was talking about by the week. You can see about an 8% increase week to week from March 14th to March 21st. We're going to ignore this one because this hasn't filled in fully yet. So we really want to focus on these two. This is the date of sample collection. So it's the most accurate numbers we have. And you can see about an 8% increase. Again, we will see if this number in the next several days gets larger or not.
So, Garrett, I saw you glance over just briefly on that sheet, broken down by zip codes. This is probably too small of a number to see any change within zip codes. Are you seeing any difference in those?
You have one zip code, the 85256, which is the Salt River Pima Tribal Reservation. They must have somehow, there must have been some reporting. They may have carried over cases from their health department on reservation to the Arizona Department of Health, because as you can see, well, I pulled it off, but 85256 cases this week, they've added 161 cases. However, that being said, they haven't added 161 cases to the curve. They've been throughout the entire pandemic. So some of these cases are 3-4 months old. So it appears that, say, the Indian Health Services that was managing Talking Stick, Salt River Pima, whether it was the federal Indian Health Services or if it was Salt River's Department of Health, they transferred cases over to the AZDHS. And
So it's kind of like what we saw from New Mexico.
Correct. We've seen the same thing happen in New Mexico.
Right.
Yes. New Mexico transferred a bunch of cases to Arizona that were Navajo Nation cases. So for one day, we had like 120 cases added to Apache County. But we didn't actually have 120 cases added. We had it added over, I think it was like 4 or 5 months that they were added. So it was just simply Navajo Nation saying, oh, we have these cases that we thought resided in New Mexico. They actually reside in the Arizona counties. And so we're moving them over. And that is most likely what happened with Talking Stick, because we can see none of the other peers. The next lowest down is 85122. I don't even know where that is, but whatever it is not, it's only 56 cases for the week. And so there's not a situation in which you're going to have triple the number of cases in one zip code that is so close to every other urban zip code. I mean, most of us who live in Maricopa County, we're a 15, 20-minute drive to Talking Stick, you know, and so this is not an isolated area. So you're not going to see an organic situation where one zip code has triple the number without a situation in which there's an administrative explanation as to why that could be.
Right. So we always want to help you guys find this information. We're not here with you every day anymore. We're only here with you on Fridays. So I want to answer Jim's question there. He writes, where are you finding your numbers? The numbers are way low, unlike what you're stating. So when we were doing this daily, Garrett, we were able to pull up AZDHS, their site, and that's where people can check for the daily numbers. I know that's not as helpful as we've talked about anymore, unless you're checking it every single day, which might not be, you are, but people at home, which might not be the easiest way to find it. Can we show Jim where there's an area to look week over week to see that change?
So yeah, Jim is seeing our weekly numbers, and so he's saying they're very high. No, I've already said the numbers are still very, very low. We are seeing increases right now of about 30% in the reported number, but only about 8% week over week right now, because sometimes the reported number does include data that's carried over from 2-3 months ago. So we are seeing an increase. it's no longer in dispute. We have an upward trend. So we've already established that. So when you want to see this, case by case, cases by day at the AZ Department of Health, you go to their dashboard, you go right here to COVID-19 cases by day. Here's the cases by day. If you want to make it easier to read, there's a little, hold on, there we go. There's a little tooltip down here. You can click that button and it turns it into weekly data. And you can see, at the peak of the pandemic on January 3rd, about 67,000 cases added a week. And right now, the most accurate week we have is March 21st, and that's at 4,194, and it's likely not going to change that much. It's going to stay at around 4,194 at this point, because they're not adding as many cases to that week as they do. So it's probably going to stick around at that number.
So just so everybody understands, because we haven't gone over this in a long time, the reason you're saying that's the most accurate week, 1 week back, is because that first bar that you're seeing there on the right side of your screen is our current week. So it's not going to be filled in completely.
Yeah, the current week always fills in. It takes about 7 to 10 days for the current week to truly be filled in. And then you see, for example, like for most days when I do my reporting, you'll have a situation where the ratio is about 80-20. So if we have 1,000 cases, just to make the math easy for me, if we have 1,000 cases added, 800 cases are added to the most recent week, and 200 cases are added to the week prior. So we're not at 1,000 cases, we're lower, but that ratio still sort of applies. It's always about an 80-20 ratio. So that's why while we're moving 14 days, 14 days, 14 days, you get to a point where you know that the number of cases that are going to be added prior to March 27th, I think it is. Yes. Last Saturday, at this point, it's a very low number that's going to be added to any day that was prior to March 27th. So that's why we now can establish that we have about an 8% increase. And so now we have to wait till next week. When we meet again next week, we'll be able to tell you if we have leveled off for this week or if we continue to increase. We don't know yet, obviously, because these weekly graphs, we can't tell you. We can only tell you once a week or so if we have an established trend. So we should know by Thursday or Friday.
So when we're seeing these numbers fill in, this is just for
Yes.
cases. It's not a reflection of deaths in our community or hospitalizations. And we'll take some time to get to that. But I think this is a really important graph for people to see the difference in what we were experiencing in July and then what we made it through in January, and what a difference that was. I mean, the highest week in January, 66,000, compared to the highest week in June looks about 27,000. It's
Yes.
an incredible difference.
It is an incredible difference. And there is no medical expert at this point that does believe that we will get to the 66,000 ever again. So
Right.
right now, there is no modeling, nobody at the CDC, no one believes that if a fourth surge materializes, because of the number of vaccinations that we have right now, we will not get to that 66,000. We may not even get to that 27,000. We
Yeah.
don't know yet. But
Yeah.
what we do know is that cases are increasing at a very slow rate right now. And now, if we keep that 30% up daily, it will no longer be a very slow rate. We'll start to see sort of, if you can see this curve, we'll start to see this step up motion right here,
Hmm.
where you're not just seeing a tiny little, dip, dip, dip.
Incremental.
You're seeing
Yeah.
like this massive jump, and that could still happen. You can see how these massive jumps, for the most part, happen in 2-week increments, about 14-day cycles, and will jump up to another level. And that's because we're getting 30% a day. Now,
So,
again, that's if this continues. It may not continue.
so this slight step up that we're seeing right now is not unlike I'm seeing. Let's see, it looks like
Yeah,
September,
right down here.
mid-September, right in there.
Yeah, right here from September, October, which is about the area where we are with everything, hospitalizations, deaths, everything else is at about this level. So you can see we are about here. So you
Mhm.
can see that. And if I were, I'd say, the data analyst in me says, oh, look at that. We're right here. We're right here. We could definitely start this motion back up. Could we? Sure, anything's possible. But the reality is, because during this event, there was no vaccine. We
Right.
now have at least 40% of Arizona adults, people who are eligible to have the vaccine. About 40% of them now have been vaccinated with at least one dose. So now you're in a situation in which the chances of these numbers happening are very remote, as long as the vaccination program continues and we keep getting people vaccinated.
And boy, it's robust as it goes right now. I want to mention a couple of changes that are happening to our vaccination system. State Farm Stadium is going to be moving indoors. It's going to be moving into Gila River Arena. I've already had some questions about people's appointments. Let me let you know that that's not happening until April 23rd. So it's a little ways off. What is happening this weekend, lots of changes at all the sites, moving to those overnight hours. So they're not going to be out there in the day. As I've mentioned, I volunteered out there. You do everything on an iPad when you're a volunteer. iPads don't love our sun and our heat. So when you're out there working on it, you're going to get one of those errors right away and not be able to process people through as fast and have to change out those iPads constantly, which is going to slow that line down. That's not what they want. So they've moved to overnight hours at State Farm Stadium. Again, that happens on Monday. And then they'll be moving indoors to Gila River Arena on the 23rd. Now, the Chandler site, they're also moving indoors. They're going to be at Dexcom, which is right there in the Phoenix Gateway Air Park complex. So you'll be able to get your vaccine inside and not have to worry about the heat, as we're seeing these numbers increase quite a bit. Garrett, a lot of people were asking about the variants. I saw Debbie's question just a minute ago. Debbie Dukakis writes, what about the new AZ variant? So we're tracking several variants here in Arizona that have come from other places, and then our own variant. What
Yes,
do you know about that so far?
saw that, and I had a website that was fantastic. So let me see if I can find it.
Because for a while we were looking at the CDC's website,
Yes,
and
here it
while
is.
it,
I have a great one. Thank you for that question, Debbie, because they're actually TGen, who's doing the majority of
Mhm.
sequencing in Arizona, has a fantastic dashboard on what's happening with the variants. And I had neglected to pull it up, and you
And
reminded
this
me
is
to do that.
this is
So
a dashboard, Garrett, that's open to anyone, so they're
yes,
able to log on and look at this
yes. Let
if
me
they
give
wanted to.
let me give producer Carrie the URL so she can put it in the chats. So yeah, let's look at this here. I've got this. This is it is made for scientists, so it's going to use words like genomes. Everybody
Mhm.
loves those kind of words. We'll try to go through these here. This is the percentage of genomes sequenced. Am I able to share my screen? Thank you.
There
Oh,
it is. Yep.
sorry. No, hold on a second. I got the wrong screen up. Give me 2 seconds. Thank you. Here we go. Got it. All right. So let's look at the sequences, what we have so far in Arizona. So we're talking about the variants. This is the March number. Pretty much every variant in Arizona that's major is a B variant. This is the UK variant right here, B117. You can see it did start showing up, at least registering in Arizona in February. Now it's at about 9% of cases that are sequenced. Most of these, now the other variant of concerns, these are the California variants, B1427 and 1429. And this is sort of what we're looking at right here is the struggle for dominance, if you will, on B117 versus B1429 and 1427. The other variants, which here's the P2, that's the, oh, hold on, let me get down. Can you take the lower third out really quick? And then I can tell you about 7 genomes, so about less than 1% were lineaged to the Brazilian variant, P1 and P2. That's 90, like less than 1% essentially. The other variants, now a lot of these variants, but 1.2, B1, these are all standard COVID-19 variants that you would, there is no difference between it and sort of what everyone has who have had COVID. Really, it's only those variants that we need to concern ourselves with. And I'll go to that really quick to show you which variants that people are concerned of, or at least the CDC, because they have several definitions, classifications of variants. So let me go to that really quick. I'll keep that up if someone still wants to look at it, but let me just go
as you were pulling that up, you were offered a toast for all your hard work this week. So thank you to Ryan, saying cheers for all you've done.
So this is the CDC's classification of variants. Very important to know because they're the ones who are obviously, classifying these variants and saying these are the variants this is what's called a variant of interest. A variant of interest means that they are watching it, but it is not spreading at an extremely rapid rate. So it's one of those things where there's several mutations in these variants. They could cause concern, but they're sort of in the yellow light category. And that's 1526, 1525. P2 is the Brazilian variant. And I believe 1526 and 525. I think that's the South African, but I'm not 100% sure. The variants of concern, these, oh no, here, that's 351 is South Africa. These are the variants that they are concerned with because they have increased transmission or they are shown to be resistant to the vaccinations in some way. So B117, that's the UK variant, P1, the Brazilian variant, 351, the South African, and then 427, 429, which is our California variants that we're dealing with right now, which is that 20% increase transmissibility. I know that there was stories out about a new variant in Arizona.
Yeah, or concern, variant of interest.
Variant of concern. Now, that is not a CDC variant of concern. That is something they're basically saying they are concerned about it. ASU Biodesign is concerned about it. It is not on the CDC's radar. It means that they have sequenced, but it's a very low number of sequences right now in total. So basically, it's on the radar of the local scientists, the local observers, but it hasn't reached the level of CDC variant of interest quite yet.
Yeah, so we'll continue to keep everybody updated on how that changes and if that continues to spread. It for the most part, right now, it seems pretty localized here in Arizona, New Mexico. I think they had a couple in Texas show up with that, but it's something that we'll continue to track. Okay, so the race against the variants, as we talked about, is the vaccinations. So we got vaccinations on one side, variants on the other. Who's going to win out? And they're pumping everybody through as fast as they can. How the percentages vary nationally versus Arizona, we've definitely done our part in getting people vaccinated. We remained high on the list throughout the list of states and how quickly we were able to get people vaccinated. We weren't nearly as fast as Alaska. They did an amazing job getting their vaccines out, but we're not doing too shabby either at this point. And I believe we were at 30%. Yes. Of everybody vaccinated, 17% fully vaccinated. So 30% partially vaccinated. And that's the US number. So we're pretty much the same here in Arizona at this point.
Yes, we do. So that's using the totality of the population now. If you take only the population that is basically the estimate of the population that is eligible
Can get it. Yeah.
because obviously you can't right now. There is no qualifications for people under the age of 16 to get it. The numbers are a little higher. We're at about 25%, 1 in 4 of Arizonans that are fully vaccinated, and about 42% of eligible adults in Arizona have had at least one dose. So that's also encouraging news, because those 30% numbers and the 17% are taking into account populations that aren't even eligible to
Mhm.
receive the vaccination. That 0 through 18 is 0 through 16.
So, Garrett, there are no numbers out there, or at least I haven't seen them anywhere, where it shows people who have tested positive for the virus and then also have gotten the vaccine. So we can see where our numbers kind of overlap, because we do have a high number of cases, people who had COVID in the last year, 843,000 here in Arizona. And if that was a number exclusive from the number of vaccinations that have happened, it would, create an even bigger percentage. But there's no place at this point that's breaking that down for us.
So there are two different databases. So the COVID-19 database, for the most part, throughout the entire country, is run on something called MedSys. Now, every state has essentially a slightly different version of MedSys, but this is basically a medical billing system, and that's how they're tracking COVID-19 cases. Now, the vaccines are run on something called not VAERS. VAERS is the reaction. I can't remember what it's called right now. I'm so sorry, but
That's
it is
okay.
a separate. It is a completely
Database.
separate database, and they've been using this database for years to basically, it's your database, it's your personal profile of vaccinations, and so they're just adding this to COVID-19. So the two don't really talk to each other, and so you can make them talk, but they don't really talk on a normal basis. And so because of that, there's really no data set out there where you can sort of see that Venn diagram of people who are vaccinated in one
Right.
circle, people who've had COVID-19 in
That
the other.
overlap in the middle.
Where's the overlap? We really don't know that number. And so it could be as broad. I certainly know it's not completely two separate circles, because I am now vaccinated.
You're in that group.
I am now in that middle circle. And when I told people this on Twitter, a bunch of people also said that they were in that middle group as well. So and it's also not going to be this. It's not going to be an overlapping circle where everybody who's had COVID-19 has had a vaccination. There is certainly going to be sort of separations in the graph. We just don't know where it is.
Yeah. Detrell saying, can we please get some good news? I think that's good news. I think that the high rate of vaccination and how well Arizona is doing is really great news.
Definitely decent news. So yeah, case numbers are climbing, and I know that some people, of course, my super friends that are watching this all the time, are going to call me a fearmonger and all this other stuff, because there's nothing we can do to make them not say that. So whatever. But the good news is that a couple things, because of the high vaccination rates in the high risk populations. So let me pull it up really quick. This is the AZDHS dashboard. And I'm going to look at vaccine prioritization. So you can see right now about 74% of people over the age of 65 have received their vaccination. You can see the number of 55-64 has climbed almost to about half. And 45-34 is now at 30%. So we're getting these higher risk groups are now being vaccinated at higher rates. So what that means is that with these case rises, even though we are seeing case rises, a smaller share of the cases that are coming in are from the 65 plus. They are at some of their lowest rates per day. On a daily basis, 65 plus is only 7 to 9% of the cases that we're seeing come in on a daily basis. When we get to a surge level, they're usually around 14-15%. Now, that's also going to impact the great thing about that is that's obviously going to impact the hospitalization and death numbers. So, because we do know that it's no question that people over 65, and we'll look at it right here. When we look at the sad sort of conclusion for some people with COVID-19, you can see the number 65 plus for deaths is significantly higher than the number. It's 6 times higher than 55-64. So this is a group that is a high risk population for COVID-19. So as they get higher vaccination rates, we will also, even if we see case rises, we will see lower deaths. We will see lower or level hospitalizations, because we won't see as much of this group going to the hospital.
which is why our hospitals are still concerned, but they're not in the same place that they were for those the summer surge and the
Correct.
fall surge, that they were sounding the alarm, because it's a different demographic that's being affected if we do indeed see this fourth
Yeah, this is
surge.
why you're not seeing now that we're starting to see sort of the evidence of a surge. Even though you've seen hospitals obviously say, "Look, Ducey, we don't really, Governor, we don't really think this is a great idea for you to get rid of the mask mandates," but you're also not seeing most hospitals saying we're prepping for a surge, because I think most of them understand that the chances of a surge of this magnitude is it's extremely remote. If not, it's never going to happen, simply because our vaccination rates for the most high risk individuals are so high right now. So if we do see, and we're not even seeing increases in hospitalizations, you can see we're looking at inpatients, ventilator use, everything is down today. So you can see, we've got some very low numbers showing up today, even in the midst of increasing case numbers. We're seeing lower numbers here. So, so it seems to be playing out that way,
Mm-hmm.
where we might see some case increases, but we will not see corresponding deaths or hospitalizations.
We are, everybody's talking about when people will head back to the office. Garrett, I'm in the office right now. You're still at home. We have no definitive answer for us here at ABC 15. But what I can tell you is some major companies are starting to announce some dates or some projected dates on when they'll head back to the office. Google is saying September 1st is their target date, which is surprising for an internet-based company, I think, to why not just stay remote if it works for a lot of folks.
Mm-hmm.
Yeah, September 1st. Bloomberg is saying after folks are vaccinated, but 70% of offices are saying that they expect to return to their office site by the fall. So I'm just wondering in the comments if many of you are hearing, if you're still working at home, if you are hearing when you'll be heading back to the office, or if you're like me, you've been in the office pretty much the whole pandemic, outside of the total shutdown that we had for about 2 weeks there over the summer. So that conversation is starting. I know, Garrett, some people love it. Some people love not having a commute. I mean, there are positives and negatives to both. Some people are like, get me out of my house. I'm sick of sitting at a bad desk that wasn't designed for someone to be sitting there all day, every day. And then the other thing, because it is a holiday weekend, that we're approaching Easter, what was that?
So that's why I got my nice chair.
See, you were ahead of the curve, because a lot of people couldn't find the desks for sale. They couldn't find the chairs for sale. On this note of Easter weekend, a lot of churches are changing their plans as well. So they're still cleaning and making sure things are safe, but a lot of them are doing away with seat reservations and things like that. So we'll see a little bit more of that as we enter this holiday weekend.
I can tell you, I was in church last night, and I'd say 99.5% masking. I think I looked out and I saw maybe one or two people in the congregation that didn't have a mask.
Yeah.
Everyone else was masked.
Yeah.
And I'm just telling you my anecdotal observation.
So did taking away this order across the state really change that much? I mean, it was last week that the governor said, okay, this is not going to go on anymore. If people want to wear the masks, or businesses want to continue to enforce it, then they can. But pretty much everywhere I've been, I again, anecdotally, I'm seeing the same percentage of people wearing masks. I mean, if they have it off in the parking lot, they're putting it on when they're going inside a store. So it's almost like not that much has changed. Garrett, I don't know if you're seeing things any differently across the valley, and I wonder if folks can weigh in on the comments on that as well.
Let's see if I can find, I'm looking at, the only thing we have is data from the Carnegie Mellon University has, and they changed the site. That's why I'm sitting here kind of saying they changed the site a little bit, but basically they run a mass Facebook survey on basically a weekly basis, asking people a bunch of questions about COVID-19. And this is basically the best information we have. Now, anecdotally, again, I can see that I don't see very much change in mask behavior out there. Anytime I go to the grocery store, I mean, pretty much the masking is still where I expect it to be, but we are seeing a slight decrease. We're usually at about 95%. Today, we're at about 91%. So actually, it looked like we were at 92%, and now we're at 91.4% right now. So we're basically staying in the same. Now let me see what Maricopa County is like. So I think I can go to Maricopa County. Yes, I can. So let's take this to Maricopa County and see. We can see Maricopa County still at a 92% people per 100 people saying that they are wearing masks. And that's down, but it's down less than 0.2 of a point. So while we might be in a situation where people are taking the masks off, it's still it's decreasing by very low numbers.
Garrett, do you know their methodology in this? How are they finding out how many people are
So they are
actually wearing
doing
their masks?
They partnered with Facebook, and so they put out a Facebook-wide survey on a regular basis, and they use Facebook's demographics, because they have access to this data. This is a partnership with Facebook to basically do a survey, a demographically accurate, statistically accurate survey. A very massive survey. I've gotten it a couple times, and they ask about 20 to 30 questions of the person that takes the survey, and this is the response. They weigh it, make sure that it matches the demographics of the state, and then they put it out. So this is what we have. So I know some people say, well, not everybody has Facebook. Sure, yeah, I mean, you're
But
right.
statistically,
A lot of people have Facebook, so it's a pretty good indicator. You're not going to have a situation in which a Facebook survey that is system-wide and partnered with Facebook, who says 90% of people wearing masks, you're not going to be a situation where it's like, oh, it's 20 points less. That's not going to happen. It might be a point in any direction, but it's not going to be somewhat to the factor of 20 points.
It's kind of taken the place of a telephone survey that so many people experienced in the 80s and 90s. Let's see. I was going to get to some of these comments. I'm seeing a lot of comments coming in. Isaac writes, "You want to live forever with masks?" No, I don't think a lot of people want to live forever with masks, but as long as we've gotten used to it, there's places that I think that even way after this, I'd pop a mask on, like a flight. You're breathing in everybody else's germs. There's a couple places I might just say, if you have a big event coming up or you're traveling, the last thing I want to do is spend my budget on going somewhere fabulous and then getting sick when I get there because of all the germs I've been exposed to along the way.
Once it's sort of not
a thing anymore.
Yeah. Wear it at the grocery store? No, I'm not going to wear a mask at the grocery store.
Right.
And like you said, maybe in a situation of an airplane or something like that, I might, now that it's more socially acceptable, I might do something like that. But no, I mean, I'm going to be honest. I'm one that will, take the mask off at the grocery store when we can.
Right. Or if my kid gets sick, I'm going to pop a mask on, so I'm not getting it.
Sure.
They bring everything home from kindergarten.
Yeah. You know what? There's exactly, there's definitely benefits to it. No, there's no question about that. I mean, like people say, well, what about the flu? Well, yeah, we put the masks on and there's no flu. That is literally the reason
we took care of it.
We don't have a flu.
We solved it.
We wear masks this year. COVID didn't take it over. I know. I'm sorry, guys.
I know.
Sorry. So many people think that flu is COVID and that all those COVID numbers are flu, but it's just not the case. Believe me, I had COVID. It's nothing like the flu. So
not at all.
It's not the same thing. But the mask did eradicate the flu this year. There's no question.
Yeah, exactly. Okay, so countries that aren't doing as well right now, we have quite a few that are seeing a massive surge. Chile, Turkey, India, the Philippines, Ukraine, Brazil. Oh, and Michael's writing exactly what I'm saying. Several countries, enduring surges for sure. They are in the height of the pandemic. They are having their highest days of case count, their highest days of death count out of Brazil. The one country that's doing it right that we've highlighted for months now, Israel, they have vaccination levels at 56% for the first shot. Total vaccination up to 51% in Israel. They're reporting day after day of no deaths. Their report today said absolutely no deaths. So they're making massive progress while these other countries are not. And in fact, Europe, they're getting dinged big time for not having a vaccination rollout. And the blame game is starting right there because Europe's really saying, hey, this is not on us. This is on the drug companies. This is on the manufacturers. But Europe is seeing only 10% vaccination rate so far. I have friends in France right now who are like, we're not even close to getting a shot or a jab over here. So quite a different story.
Let's look at DVAC 91, and it shows exactly what you're talking about. Now, I've got it looks like a mess here. I understand that, but that's because I don't have anybody highlight. Let me just show you what generating this report looks like right now. You can see in Europe, you have some countries that are seeing 73, 74% increases, 50% increases. If we let's isolate some of the bigger ones. Let's go to Germany. Here's Germany. You can see Germany is approaching its peak. We'll go to the United Kingdom. You see United Kingdom's on a low right now. Absolutely. We'll go to France. I know France just, I believe France just instituted a lockdown, correct?
They did last night or the night before.
Yeah. And
Yeah.
you can see France is
Wow.
climbing up to its pandemic, its peak levels. So yeah, you're definitely seeing case surges in Europe right now. No question.
Yeah, so definitely a concern over there. Reach out to friends and family who you know over there, because they are in the height of this.
Yeah, I want to see. You said something about Israel. Oh, sorry. Let me
Yeah,
see.
Israel has huge vaccination rates, and it's really it's showing. Look at that.
Look at that. I mean,
there's no denying that.
Nothing. I mean, it's down. Let's see what Israel looks like to the rest of the Middle East. Is that Eastern Mediterranean? Yes. You can see Israel has pretty much some of the lowest numbers of normalized population in the Middle East right now.
Yeah. Okay. So once you do get vaccinated, how do you take care of your vaccination card? I want to let you know one of the best tips that is out there right now is you start by taking a picture of it with your phone. They say you should email it to yourself as a backup. You can laminate your card. Places like Staples are offering free lamination for the next few days. I think it wraps up this weekend. They'll laminate. Yeah, they'll laminate your card to make it more durable. The only concern in that has already been brought up is that that would prevent future information like your booster shots from being added on to that. But in the meantime, the big thing they're saying to do is make sure that you at least have a screenshot in your phone and that you've emailed it so that you have definite backup. Because if this becomes a thing that's getting you into your favorite concert or getting you into a different country for a vacation, then you're going to want to be able to have that and show that. So those are the best tips for it. I've only taken a picture, Garrett. I have mine taped up on the inside the cabinet somewhere safe. We each took a picture when we got ours done, but we haven't gone to laminate it or anything else just yet.
And I know there's going to be a lot of comments in there about, vaccine passports and stuff. And, we're not going to talk about that here. We're COVID-19 data.
Yeah, exactly.
We're not going to talk about that. I know there's going to be a lot of people that either are like, oh yeah, I'm fine with this. And there's going to be people that are just, they hate the idea.
Yeah.
And
we've continued to be all about the numbers and news you can use to be able to keep yourself and your family safe and make the best decisions for you. Yes, exactly. One of the other changes that we're seeing, Diamondbacks are adding more seats. So if you're interested in heading to the games, they're opening that up. More tickets go on sale on Monday. We've seen some of the same things for other sports and other teams. We did see opening day happen yesterday, finally with fans. So a reason to celebrate for many folks. The Mets and Nationals, their game was postponed due to COVID concerns, and now they've actually postponed the whole series. So it's just proof, Garrett, that we're not totally over this yet, even though we are seeing some signs of life, if you will, and people starting to get back to normal. When you have teams still having to say that's not going to happen, we're not going to be able to play.
A situation where 65% of our cases today came from under the age of 45.
Yeah.
So if you're doing an industry like something like sports, where, professional sports, a lot of people who are involved in
that age group
are under 45.
Yep.
So there is some risk of COVID for those individuals right now. There's no question of that.
Yeah. Okay. So we're heading into a holiday weekend. Garrett, what things are you going to be watching closely as we head through this? And as I ask you that question, I do want to mention one other place that people can sign up for vaccinations this weekend. Arizona and Equity Health have partnered, and they're going to be over at Isaac Middle School. And really, it's going to go on from 7 to 5. You can get signed up over there. There's also food boxes. So this is a highly targeted vaccination site for folks in that neighborhood as well. If you want to sign up, equityhealthfoundation.org is the site /1. So equityhealthfoundation.org/1. And then the pod vaccine thing that Carrie has up right there on the screen, that's for our state-run sites. That's podvaccine.azdhs.gov, or you could simply call 211. Remember, a bunch of appointments went online at 11 today. I've not heard if they're gone already. I'm sure they probably...
I can check really quick.
I'm sure they are.
Anymore now that I'm vaccinated.
Yeah, exactly. Yeah, you can't even get in there anymore. Jeremy, if you're asking about that Isaac site, I don't know what the parameters are on who they're allowing in, but head to that website and I'm sure it'll give you more information. If you can't get through over there, just dial the 211 number and they'll get you set up for one of those pods as well. New appointments for those pods come online at 8 in the morning. Those are the cancellations or anybody that has no-showed or they're not able to get over to the appointment that they made. Then it's going to be opening up at 8 a.m. for folks to sign up. So if you have somebody that's between 16 and 18 years old who wants the vaccination, remember they've got to get something signed by the parent, and then also they have to sign up specifically for a Pfizer shot because that is the shot that is approved for that age group. Were you having any luck on seeing if those were gone, Garrett, from this morning?
I'm looking right now. Let's see. There's actually a couple.
Yeah.
Oh yeah, there's still a bunch left for Cardinal for
State Farm Stadium.
Farm, there's still a bunch left.
Okay, so remember, most of those that you're signing up for, they're going to be in those overnight hours. So if that's a concern for you, then you might want to check some of the other sites.
Muni, Chandler doesn't have any left over, and Southwest Mesa has none. So basically, you're looking at Phoenix Muni and Cardinal Stadium, but Cardinal Stadium still has a bunch of appointments left over.
Yep, keep in mind overnight hours.
Yep. Yes.
They're all overnight.
Yeah, they're all 1:50 to 3:50 a.m.
Okay. Remember, you don't have to go exactly at that exact moment if you snag an appointment at that time, but because those hours are now only in the night, you're going to have to show up, within your shift to be able to get a vaccination. And they've added staff out there, paid staff, because it was up to all of us as volunteers to be out there processing everybody in the volunteer excitement, I'll put it as such. The volunteer excitement and enthusiasm to get signed up kind of waned as many of the volunteers got their shots, because that was one of the perks of kind of doing the shift out there. So let's see. So I had asked you, Garrett, what things are you going to be watching this weekend in these last few minutes and throughout this week? Because we'll be back here with you. We're aiming to be back next Friday.
Essentially, what I'm looking for right now is we know that we're in the midst of a case increase. That's no question. So now what we're looking for is what's going to be the difference of this case increase to previous increases. Is it going to slow down considerably? What will the age groups continue to be? Will that 65 plus continue to be depressed? Only 5 to 7% of the cases. These are very important numbers because at that age group right now, I'm really laser focused on that age group number because that really is going to tell what's going to happen with hospitalizations out here, which we know are always the most important numbers. I know some people say case-demic. The hospitalizations and deaths have always been the most important numbers. And but case numbers always come before hospitalizations and deaths. Mm-hmm. That's why we focus on case numbers, because if case numbers go up, we know that hospitalizations will go up, and then 10 to 15 days later, deaths will go up. So we're in the midst of a case increase right now. If hospitalizations don't go up by early next week, then we already know that this is just sort of a situation where people who are younger are getting it, but it's not going to impact the hospitals.
Yeah. And I think one of the concerns is that is the variant, because if something becomes stronger for that age group, that's
exactly. And then, of course, very unfortunately, people do die in these age groups, these younger age groups. It is about a quarter of the deaths from these age groups. So it's still a very tragic situation when the hospitalizations and the death rises. I just want to make sure that everyone knows that, there's still a consequence for some people of getting COVID-19. And like you said, with the variants out there, we don't really know what is going to happen with the variants. Most of the variants, what we do know from the CDC is that the vaccines are very, very good, very good at preventing major or moderate or major symptoms of COVID-19. Even if, like say the South African variant, even if it can't stop the disease, it almost always, it cuts down the hospitalizations and zeroes out the deaths, I believe, at this point.
Yeah.
There is one death of a COVID-19 from someone who contracted COVID-19 from a variant that has been vaccinated. I haven't seen that yet. I don't think it exists.
Right. What we are still though losing is we'll hit 1,000 people today. We've already lost 844 people. So there are still families that are definitely still in this fight. 554,000 Americans lost in all of this. And I know that we just talk about the numbers here, but we remember that there are real people behind those numbers. And I want to mention that every single time, because I know there are people on here who have suffered disproportionate loss because they have lost someone to COVID-19. So we think of them as we continue to talk about these numbers. And then we also want to wish you a very safe and happy Easter. I know a lot of people put it on hold last year and are coming back together. So please do so safely. By the way, the CDC also said that if you are fully vaccinated, you can probably go ahead and travel without worry, that you can be with others who are fully vaccinated without worry. So some better news this year as opposed to what we were experiencing in 2020. So in the meantime, I want to let you know where you can find all of us. We're out of time for today. We have to get ready for our newscast. We have newscasts coming up at 4, 5, 6, 9 p.m. over on CW and also at 10 p.m. So Garrett's Twitter is at Garrett_Archer. Mine is at Katie Rammel. You can also find me on Facebook. We continue the conversation over there. That is facebook.com/news from Katie. And I mentioned all of our newscasts, but if you want to find out more about our coronavirus reporting throughout the week, things that we don't get time to talk about here, including this back and forth between the mayor and the governor, there's a whole big fight going on. We ran out of time for that, but I can guarantee that our reporters are going to be on it for you tonight and what's happening there. And
we don't know. Just to answer the last question, we do not know when vaccination will be available for under 16. They're in trials right now.
They're in trials right now, down to 12 years old, and then they'll lower that again. So it will continue to keep you all updated. Michael's writing, thank you both. Thank you, all of you, for joining us on here and spending some time to stay updated on this public health concern. And we continue to update you on Fridays now. So that's the day that we're here with you. In the meantime, have a very safe weekend, and we'll see you all here, hopefully with even better news next week.